Police, Kenya Red Cross ak disaster team kobun serikalitab county nebo Nakuru eng sarunetab biik chotok chekaityi nyasutyonoto ole kaibet meng'otosiek kapchi chesirei 15. Kaikoito kurset kibagengeitab Kenya National Highways Authority eng ketikab karisiek koistoegei oranatok po Maimayu amu makobunaksei kosubkei ak nyasutyonoto ole kakisom icheket koboisie ortinwek alak chotok chebitunotin. Yekitestai logoiwek ko katestai kurset eng biikab emet koribgei mising eng kasari tesetai ropta neo eng kebeberwek cheterter eng emet. Kamwa ng'ololindetab serikali Isaac Mwaura kole agoi nguno kokobet sobonwekwak biik cheitei 103 kosubkei ak nyasutik chetinyegei ak maranet ak ng'ashakanetab ng'onyut ole kaito noto kotomo ketesyi biik chotok chekaibet sobonwekwak eng nyasutiet noto nekabit eng komasta nebo Maimayu. Kong'ololjin sirikab logoiwek eng taunit nebo Mombasa, komwa Mwaura kole bichotok koibet sobonwekwak kale koboto 21 chebunu komasta nebo Rift Valley ak 32 chebunu county nebo Nairobi. Kasom ine biikab emet koistoegei komoswek chotok chemite maranet mising ko ainosiek asikekirinda kobetetab sobonwek chekoketestai kebaorionji eng nguni. Eng kasarato kosom ine biikab emet ak kibagengeisiek chetinye maget nemie komongei asikotoret biik chechang chotok chekokoityi kaimutik chotok po maranet chekokobet meng'otosiekwak ako makchingei toretosiek chotok chebo amitwogik ak ole ibure eng kasarta netesetai serikali kochengei ole imuti bichotok.
Through the Ministry of Education, the government has resolved to postpone the opening of all primary and secondary schools by 1 week from Monday, May 6, 2024. The move is intended to safeguard the lives of learners and staff in the affected areas and to enable the government to put in place adequate safety measures in all the identified schools and communities. The National Multi-Agency Response Committee on Floods is undertaking varied response initiatives to cushion the affected populations from the effects of the floods. The official number of those who have lost their lives currently stand at 103 Kenyans. 103. This number is a little bit higher, it's good I tell you. We will report about the exact number tomorrow because it has to be verified. The Rift Valley region has the highest loss of lives at 21, and 29 people have been injured, and 21 persons have reported missing. So 29 people have been injured, and as of now, 21 persons have reported they cannot be traced. The number of displaced households currently stands at 28,484. The Kenya Meteorological Department has alerted the public about the persistent heavy rains that are likely to affect various regions, including the Lake Victoria Basin, Southeast Lowlands, Highlands, east-west of Rift Valley, Nairobi, and northwestern Kenya. The government consequently advises the residents in these areas to keep an eye out of the flash floods and poor visibility.
Yetesetai kokayai bandab oret konetik cheineti Junior Secondary School nan JSS eng county nebo Elgeyo Marakwet. Notok ko katorchinet nebo kisimchi commission netononjin siretab konetik. Ko notok ko kosir ichek boisiet kong'etegei contract akoi permanent and pensionable anan kotestai icheket kongelelchi boisiet nebo konetisiet. Kaindochi sirindet eng katuiyetabgei nebo konetik nebo Kupet mornet nebo Elgeyo Marakwet Paul Biwot konetichoto ole kaikimit kole mabendi koyani icheket kotestai konetichotok boto kobune kaimutik mising ko eng kasarta netogu ko kituptochi batai commission nebo TSC konetichoto.
Interns have really suffered for long.
Confirm JS interns Mogu's power. Kaende.
Kaende.
ko ng'oliot nebo let nebo kanetik chebo JSS en county nebo Elgeyo Marakwet kasarta nekaituito karikab boisiet akomwa kole mabendi kowekse konetishe akoi koyochi ichek imanda commission netonondochin siretab kanetik boisiet nebo TSC. Ole kamwa ichek kole moche commission noto kosir ichek boisiet akoistoengei boisietab oretab kalotunet.
We are earning peanuts, yet those who graduated after us are enjoying permanent and pensionable job because maybe they have that connection with some of our politicians.
Many of us here they are not married because the peanuts is not enough for someone to marry. It cannot even raise a family. It cannot raise a family. So we are requesting TSC to compensate us and also confirm all interns. No compensation, no going to school.
We want to fight the discriminatory nature in which the TSC used to determine who is a PNP and who is an intern, and yet all of them belong to the same cohort. Comrades, power! Mogul, power! So we are demanding for that right just as a patriotic citizen who obeys the rule of law. Nothing outside the law. Obey the rule of law. Confirm JS interns. Moguls, power! Kaende, kaende! Comrades, power! Tosha.
Kaindochi kanetik choto sirindet en katuiyetabgei nebo kanetik nebo Kupet mornetab Elgeyo Marakwet Paul Biwott ole kamach commission nebo TSC koityi kamanut tilet nebo kapkirwok ako kushikong kanetik choto.
Just confirm the teachers now. Yes. Instead of taking it to July, confirm them now. So we are requesting the employer under the able leadership of our CEO, Dr. Nancy Majaria, that follow the law and accept what the code guided you to do. So it is in order that our teachers, under our law, that nobody is supposed to be under a contract more than 6 months. After 6 months, one is supposed to be confirmed. So we are requesting the employer to do it so with an immediate effect.
Kotinygei ak ng'alalet nebo CS Moses Kuria kole nyolu kesir boisiet en kandaras kiboitinik en emoni ko kamwa Biwott kole mayani ichek noto kesuldae en konetikab emoni.
So we are requesting the CS who said it in the morning that all employees of this country must be under. Which other country are employees employed under contract? So we need to inform you that you are misguided and we will not allow that. And if possible, you can look for another ministry which you are able. If you are not able to guide the government under the able leadership of our His Excellency, the President, Dr. William Samoei Ruto. So we are requesting you, Bana CS, withdraw that statement with an immediate effect and do other things. The other thing which we are also requesting the employer is to make sure that these teachers who are under internship at the moment must all be paid their money. Yes. They must be compensated what they were supposed to have been paid all of that time.
Kong'ete taunitab Iten en county nebo Elgeyo Marakwet, logoiywekab emet chebo Kass TV, kaninyi ko Timothy Kiplimo.
Kotakemi logoiwechoto ko en county nebo Nandi kokaba akichek bandab oret kanetikab junior secondary school ako ofisitab Teacher Service Commission nebo Nandi komeche kisimchi kibagenge inato kesir not nebo TSC kokonyit tilet noto nebo kapkirwok ak kosir ichek eng permanent and pensionable asikomuktochi kosuldae boisionikwak eng oret neititaat. Aritae Kupet Secretary nebo Nandi Paul Rotich TSC eng nekamwa kole kikotestai kobut ng'atutik chotok chebo siretab konetik ole ikochin noto kandoikab bolotet ako manyolu kou noto logoiwek chekiarorwech sirindenyo Cornelius Keter.
Kong'alaldos eng taonitab Kapsabet komwa Wilfred Bet ak Valentine Chepleting che kanetikab junior secondary schools eng county nebo Nandi kole nyolu eng ministry nebo somanet kokochi tilet nekikon kapkirwok eng mwaet kole nyolu eng serikali kokochi icheket baronokab permanent and pension nebo ole kamwa kole bune kaimutik kanetikab junior secondary schools kosubkei ak melekwek chemi ng'ony che ikochin serikali kit nekokowekta let kimnatenywa nebo kosuldae boisienywa nebo kanetisiet.
Following the judgment and the ruling which was made about 10 days ago by the court that the internship is contrary to the law. Internship is illegal, and therefore the JSS of Nandi County deserves confirmation into permanent and pensionable. JSS power. In that regard, we want to ask the Teacher Service Commission, without taking a lot of time, to confirm the muggles, the interns, both the senior and the junior, into permanent and pensionable.
This country is ruled by the Constitution, which all of us are law-abiding citizens. The same case, all the other court rulings are respected. Then this one of the JSS teachers, because all of them are Kenyans, all the rulings were made by the Court of Kenya, then it must be abided to the latter. We want to tell the TSC that we are suffering. There are a lot of suicides going on. There is a lot of depression going on. What can 17K, which is rent to some of those government officials, do? 17,000 for someone who went to class for over 4 years, to pay rent, to pay school fees, to feed their families, to even pay for their own upkeep. Some of us have been working in very remote areas where you need to access the same schools by public or means of transport.
We are saddened by the fact that every now and then we get a few individuals being employed into permanent and pensionable, whereas the rest of us are being told to wait for the next confirmation. So we want to disagree. We want to disagree with that. With the strongest terms possible as the JSS of Nandi County.
Kamwa Stephen Lagat kole machobotin kanetikab junior secondary schools en county nebo Nandi kowektagei sukul agoi kasarta nekaisuldae serikali magutikwak.
We are not going back to school. Take note of that. We are not ready to be involved in an illegal work. Let them come out officially and announce that when are we going to be confirmed into permanent and pensionable immediately.
En kasarata korirtae sirindet neo nebo kupet en county nebo Nandi Paul Rotich kibagenge nesire kanetik en emoni nebo Teacher Service Commission ak mwaet kole makosubi ngatutik ak arorutik tugul en siretab kanetik koboto neikochini baronok chebo siretab kanetik boisiet kandoikab bolotet.
We have seen politicians dishing out employment letters, and if we are not careful, we are going to politicize education in Kenya. In fact, it is whispered that the letters which are being dished out are 3/4 of the total letters which are rolled out for employment. To mean only a quarter are subjected to teachers on interviews. 3/4 they are dished out left and right. In that ruling, it was very specific that the interns must be compensated.
Kongete taunetab Kapsabet en county nebo Nandi, logoiywekab emet chebo Kass, kainenyu ko Cornelius Keter.
Yetesetai kokaimongei kibagengeisiek chebo konetik eng Bomet County ako nerekchi kit noto anan oret noto nekoboisie ministry nebo somanet eng kakoitoetab logoiyot nekoibarasta kole kakisipto yatetab sukulisiek kosubkei ak ropta neo nekokotestai kokon ng'emisiet neo. Kosubkei ak kibagengeisiek choto kamwa kole kamakonyolu kibarasta logoiyandonoto eng saisiekab kemboi eng kasarta nekakotokchigei oret kipsomaninik alake komito oret kobendi sukulisiek. Ngine kamwa kole kaimagis kipsomaninik choto akomuch kora koityi ng'emisiet noto nebo maranet eng oratinwek kote kowek akoi gaa.
Kosubkei ak kakwautiet nekoib ministry nebo somanet nebo kokon ng'atutiet nekaisipto betut nekeyote sukulisiekab emoni kokaibor neregek kibagengeisiek chebo konetik en county nebo Bomet en mwaet kole noton kokaibor kandoinatet neya en minister nebo somanet ak biik chetelelchin somanet en emoni. Kondochin sirik cheechen chebo kibagengeitab Kubet ak nebo Naat en mornet nebo Bomet kokamwa konetik choton kole kamakonyolu kekon logoiyondonoton en kemoi kwen en kasarta nekakochopchigei lagok koba sukul.
So it's unfortunate that even the students have traveled, and unfortunately because of the rain havoc, we don't know what can happen to them on their way, because in our nature, even the government is not sensitive enough to the life of our learners, because everywhere is flooded. So once you send them, how sure are they that he will arrive safely to schools? Leave alone about postponing. What about were they mindful about their traveling before postponing?
Some students even started going to their schools as far as yesterday.
they planned, even as far as yesterday, some of them were just traveling. You know, we have students traveling from all corners of the Republic of Kenya. Some are coming from Kisumu, all the way from Kisumu to go to Mombasa, and you are just coming very early in the morning to say you have really postponed the opening of the schools. That is very wrong.
Kora kokoibor ichek kaimetabkei en kit nemwa kole atororetab konetik chebunu counties alak ak iyok kobwa county nebo Bomet ako makitorori konetik chetesetai ak boisiet en county nebo Bomet.
We are appealing to the regional director TSC Rift Valley to come out clearly and explain why this is only affecting Bomet alone. Why are we not hearing even Narok having this influx of new head teachers and principals? Why are you not hearing Kericho people also having these events going on? It is only in Bomet where we are getting every year in, out, we are getting new people coming to replace people who are already working well.
Anereki ichek kibagengeitab TSC en mwaet kole kakotaban konetik chebo Bomet mising ko en kasarta nekitorori konetik choton.
Bomet is one of the topping counties in this republic, including we had a case from Kamrita last year, a county school which produced an A student. So this is going to demoralize our locals. What you know is that Parliament pays out the localization unless it pays out in 46 counties except Bomet. That is what you want to know.
En kasaraton ko kayai bandab oret konetik chebo junior secondary chekikisir en contract en county nebo Bomet komache ichek kesir en oret nebo permanent.
We are here for one main cause. Yes. That is the Teacher Service Commission to confirm all interns. Yes. The word intern is illegal. It is not in the Teacher Service Commission. It is not in the Kenya 2010 Constitution. Therefore, we are saying it is illegal. And in this regard, we want to tell the Teacher Service Commission to compensate all the interns and to confirm them.
Avoid discrimination. Equal work, equal pay. We are always graduates with those PNP. We did the same job. We did the same learning areas, and you pay us the same. No, stop discrimination among us. Mati Masharia, I'm still talking to you, my sister. Compensate, confirm, intern, teachers. We are not going back to school as from Monday. Each and every Monday we'll be on the street.
Kongeten county nebo Bomet, logoiywekab emet chebo Kass, kainenyun ko Sylvester Ronon.
Yetesetai ko tetei emetab Kenya tuyet nebo ripset nebo logoiwek chebo kamanut chebo biikab emet anan data protection kongetegei tarik 7 agoi tarik 10 nebo arawetab mut. Ole ituitos tuyonoto emotinwek chesire 23 chemitei eng katuyetab kei nebo the Network of Data Protection Authorities. Kamwa Data Commissioner Immaculate Kasait kole takchingei tuyonoto kengalale ortinwek chekinoisechin biikab emoni imandanywa ak kerkong'et noto nekipchin biik cheng'ong'doi logoiwekab kamanut chebo biik ama eng chomchinenywa. Kinyoru sirindenyo Caroline Kiplagat ak logoiwechuto eng koindo.
Eng tuyet ak sirikab logoiwek eng taunetab Nairobi ko aroru Data Commissioner Immaculate Kasait kamanutietab tuyet noto neituisot emotinwek 23 nekamwa kole tokchini kolitiet ng'atutik chetinye ripsetab logoiwekab kamanut cheterterchin en emotinwek cheterter.
Data Protection Authority is a regional association of for African data protection authorities, which bring together over 23 countries. And the 23 countries came together for purposes of networking and also sharing lessons learned on matters data protection. So this conference is an opportunity for the entire Africa to come and discuss critical issues in data protection, such as data flows. Data flows is basically how does information move from one country to the other? How can we remove the barriers? How can we make it easier for trade? The other issue that we'll be discussing, which is concerned, is issues around harmonization of data protection framework. We know that different data protection frameworks are different in different countries. It becomes compliance difficulty. How can we start having conversation as Africa in terms of data flows?
Kamwa Kasait kole kongete ketou ofisitab data commissioner ko kikotach kang'unyng'unyosiek 5,000 che alak eng choton ko kikekusikong akot eng kasarta nekasom biikab emet kokoito kang'unyng'unyosiek chetinye en ofisinyin akot ko kokiboisie logoiwekwach ama eng chomchineng'wany.
5,000 is what we have had so far since we were established as the office. It suffices to say, under the Data Protection Act, we have completed the cases that were supposed to by almost 75%. And the Data Protection Act provides a timeline. Within 90 days of filing a complaint with the Office of the Data Commissioner, we are supposed to make a determination, either to dismiss, either to issue an enforcement notice, or either to penalize. And if you go to our website, we do determinations every week. And all the determinations we have determined are posted on our website. Some of them are like the one you talked about, the one that caused the national eye. And for your information, there was an appeal and the appeal was sustained. The school was told to pay the penalty. There are others which have been minimal. We've had cases where we have determined in the recent past for health institutions that have violated right to privacy, mounting surveillance. We've had cases of even designers who have picked the videos of their clients without their consent and played on their Instagram pages. Because we determine a lot.
Kosubke ak muswoknotetab kasari nenaat kou artificial intelligence nenguni kotomo kosuldaen serikali ng'otutik chik komwa afisayat eng ministry nebo ICT kole ngandan tesetai boisietab AI eng chepchebindo neo eng emet ko tesentai serikali tetutik chebo keker kele kiboisien muswoknotet noton en oret nenyolu ak kora ole making'ongdoi logoiwekab komonut chebo biikab emet.
In terms of government, we are already moving with speed and working on an AI strategy. We realized instead of just giving guidelines and policy on AI, it's first to engage the public and the private sector on a strategy for AI so that we can come out with a substantive law that governs AI. It's a new field for everyone, and if you realize internationally, most likely it's only 2 countries who have been able to come out with proper regulations. That's US and China on AI. The rest of us are playing catch up, but I know Kenyans are very versatile.
Caroline Kiplagat, Logoiywekab emet en county nebo Nairobi.
Mitei kamang'unet nebo kwa barak mung'aret notok nebo minetab kawek eng Baringo County. Kamwa Deputy Governor nebo Baringo County Engineer Felix Mayo kole tindoi ine kamang'unet neo akobo notok. Ole kosubkei ak Mayo kale ko county nebo Baringo kale ko kokochutyi kabatik kebeberta 75 minset notok nebo kawek akobendi konyorune kelchin neo eng betusiek chebwone.
Eng kurset nebo kolsetab minutik netinye ak mung'aret not ko kilimo biashara ko kokotes kabatik chebo kawek eng Baringo County kawek kong'eten kawek keite 896 akoi kawek keite 4.4 eng kenyisiek 8 chekokosirto. Kosubkei ak rubeiwot nebo Governor Baringo County noton ko Engineer Felix Mayo komwa ineten kole kakwautiet noton bo tesekab kawek eng komoswek nebo Baringo County kokotes melekwokik koboto rurutik chetinye kawek.
Baringo farmers have been engaging in both the Nairobi Coffee Exchange and direct sales to Korea. And we have also Katimoka has been able to process 100 tons of coffee, and plans are underway to export 4 tons of coffee to Korea, which will earn our farmers close to 25 million Kenya shillings.
Deputy Governor kole tingen kamang'unet kakwautiet noton bo kolsetab kawek ako kochi kurset ming kimiten komoswek chebo Mosop chebi eng komoswek cheterter chebo Baringo County mising komoswek chebo Eldamarabin, Mochongoi, Baringo Central. Koboto alak komoswek chebo Baringo North koker kole kakoljigei kawek asikobit konyorchigei kelchin.
The county and its partners have been supplying certified coffee seedlings since 2015, where the area under coverage has increased from 896 acres to 3,200 hectares, which translates to 4.4 million coffee bushes as per the last year statistics.
Kini koyonchinge kora MC nebo Tenges noton ko Henry Kigen na agenge wardin ni kokole kawek eng kinamonet kole tukumiten ngweny kora kokutiet anan kokolet nebo kawek eng neranik.
Most coffee farmers are old men. The youths have not embraced this coffee thing as such. And we want to ask that our CPA to encourage the youth. Maybe they give them a small portion of land that they can do coffee. Because if you do even 100 seedlings or 200 seedlings, because an acre takes like 1,000. If you can do even on half an acre, or even a quarter, which is 250 seedlings, so that our youth can embrace this and they can see this thing as a reality. Our youths have not really taken up this coffee, because if you see even today, majority of those doing coffee are old men.
Kongeten taon tab kabarnet baringo county Logoiywekab chebo Kass kekurenon Tom Chepsoi.
Kakomwa kandoikab Kenya Kwanza kondochin MP nebo Emurua Dikir Joanna Ngeno kole nyolu keipchi kakwautik chekimen chebo kerkong'et icheket chotok chekitinygei ak kaberberisiet nebo letaetab mbolea chemaititotin koityi kabatik. Ole moche kora Cabinet Secretary nebo kabatisiet Mithika Linturi kong'ong inendet tuguk cheingen akobo noto. Logoiwek chearoru sirindenyo Isaac Kogey.
Kong'alaldos eng komasta nebo Matharu eng Band Forest Keses County noto nebo Uasin Gishu komwa kandoichoto koboto MP nebo Keses CPA Julius Ruto, MP nebo Emurua Dikir Joanna Ngeno ak MP noto nebo Mukurweini John Kagusha kole nyolu keipchi kakwautik chekimen biik tugul chotok chekitinygei ak letaetab katoldoleiwek chotok chemaititotin.
Na nimekubaliana ngao mmetuambia tusiguse waziri wa serikali yetu ya Kenya Kwanza, pia tunataka kuongelesha waziri wetu Linturi. Sisi tulipochukua hii serikali tuliambiwa maneno ya bottom up. Na rais ameanza kutekeleza agenda yake, ikiwemo subsidized fertilizer ambao mwaka uliopita hiyo ndio ilitusaidia tukainua kilimo, chakula kwa nchi ya Kenya kikaongezeka, bei ya gharama ya chakula ikateremka. Sasa hizi tunavyoongea mwaka huu kidogo tuko na shida. Na tumeuliza waziri afanye kazi yake kama waziri, a exercise administrative action, wale ambao walihusika kama ni National Cereals and Produce Board, tuone kwamba amechukua hatua, watu wapikwa kalamu waende nyumbani ili wakulima waweze kuheshimu serikali yao.
Lazima tufanye recommendations. Anybody who is involved in any corrupt activities, lazima tu recommend wafungwe. Hakuna namna nyingine. Na nataka niombe mawaziri ambao wamepewa kazi ya kufanya. Hatutaki tuwaibishe serikali ya rais. Hii serikali yenye rais alitafuta na jasho. Alafu sisi wengine yenye tumepewa majukumu tunaharibu. Kwa hivyo we want to see heads rolling kwa hii ministry ya agriculture. Hii mastori tu ya kupiga mastori ati tunafanya uchunguzi inafanya mwezi mzima. Hii tunasikia kuambia watu wamefungwa, watu wawekwe ndani. Kwa sababu hii fertilizer imeingizwa kwa materials. Iwezi kuwa imeshuka juu ya hewa, ililetwa na mtu. Iliingizwa kwa cereals na mtu. Kwa hivyo tunataka kuambia wale ambao wana jukumu ya kutekeleza hii kazi, wahakikishe kazi mzuri imefanyika.
Mwae icheket kole bendi koyoe kit age tugul eng bunge noto nebo emoni koro kole kawal CS noto nebo kabatisiet Mithika Linturi amune asikebaorionchi kaimutietab katoldoleiwek chotok chemaititotin eng emetab Kenya.
Shida sasa ni wale watu ambao wana supply ama wale watu ambao walipewa tenders ya kuleta fertilizers hapa. Na tunaambiwa kuna mabwenyenye ambayo kila wakati wanaenda kuleta fertilizers huko nje. So sisi kama wajumbe, sisi kama makamati, tutahakikisha kwamba there is zero corruption in every ministry yenye tumepewa.
Lakini jinsi waziri ametulia na amenyamaza kule bunge, tutafanya kazi yetu. Mlituchukua kuwakilisha nyinyi kama wakulima ama namna gani? Na wakati mkulima alindwi na haki ya mkulima alindwi, sasa kazi yangu kama mjumbe ni nini?
Kaboisie kasarata kosom biikab emet koribkei mising eng beekab ropta netesetai kebaorionjin eng emoni nekotestai koib asenet neo mising.
Kama wewe unaona pahali umekaa kunaweza kuwa na hatari, tafadhali usiendelee kukaa pale. Inua mkono juu, inua sauti, ongea na chief, ongea na wale wengine, serikali iweze kutafuta namna ya kukusaidia ndio tusiweze kupata maafa ya watu wengine. Na tena tujaribu sana Pahali tunaenda vile tunafanya mambo yetu, tuangalie sana ile mambo ya mafuriko ambayo iko siku ya leo.
Some icheket biik tugul cheimuchi komeng'isie eng ole imuch koityi kaimutietab ropta koistogei akocheng komoswek chotok chemitei komie.
Lazima pia tukue uangalifu wakati tunatembea, wakati mto imefurika. Please tafadhali, do not be daring. Kuna watu ambao hawajali maisha ya wale ambao wanawabeba. Saa hii tukiambiwa kuna mfuriko yenye ilifanyika hapa Maimayu na imebeba watu wengi sana, na tunataka kusema pole. Tunataka pia kusema wale ambao wako chini ya madams ama dams yenye saa zingine inaweza bomoka na kubeba watu. Please tafadhali tuhamie mahali yenye tunajua iko very safe.
Kong'eteke taonitab Eldoret eng county nebo Uasin Gishu, logoiywekab emet chebo Kass, kainenyu ko Isaac Kogei.
Kakocher MP nebo Ainamo eng county nebo Kericho, Ambassador Benjamin Langat, meng'ikab kot neing'ate ng'atutik nebo Ainamo koboisie chepkondok eng oret nenyolu chebo grupisiek eng grupisiekwak chebo Uwezo Fund, chepkondok cheite silingisiek milionisiek 3.8 asikobit sonan chotok chekipchechin grupisiek 31 eng komasata kokakicher koboisie eng oret nenyolunot asikonyorune kelchin. Logoiwek chearorwech eng koindo sirindenyo Robert Siele.
Kong'alale kasarta nekaindochi lumdaetab kokoitoetab rabisiek kobun legutab Uwezo Fund chebo million 3.6 komwa MP nebo Ainamo Ambassador Benjamin Langat kole magat eng grupisiek yanyor rabisiechoton koboisien en oret nenyolu ole matindoi interest age tugul.
En raini kakikoite milionisiek 3.6 grupisiek 31. Chempia ko grupisiek 21 ak chekiako kosom akowek akewekyi kora ko grupisiek 10. So kwa ujumla kokanyor grupisiek 31 ako kikochin icheket 2 years ako zero matindoi interest.
Kacher grupisiek kowek rabisiechoton asikonyor tesetab rabisiek ako kanaptaen grupisiek alak chetomo konyor kelchin.
Kimoche grupisiek bokai biashara akowek sikekoi kora rabinik amun mami ole kenyorchin rabisiek chemakiyochin interest. It is only in Uwezo Fund. Kamwa ale grupisiek chechang some groups komawek, lakini kakemwochi raini kelenji kowek amun yewek kosome kora kenyilen aeng. Number 2 ko yewek kosiche grupisiek alak chetom konyor amun chang grupisiek chemache rabisiek choton ako tom konyor amun kitinye rabinik tuten.
Kosubkei ak afisayat neo en ofisitab county MP nebo Kericho anan county manager Patrick Cheruyot kokamwa inendet kole bo kamanut toretosiek cheu choton kobun serikalitab emoni ole magat keboisien en oret nenyolu.
Supporteni this program asikobit keker kele kainuanak uchumi nebo Kericho County en komosta nebo chepyosok, vijana ak persons with disability. So kimoche kewekyin kongoi serikali ak kesome kora kele takotes rabinik chuto the revolving fund ak rabisiek chemiten komosta nebo National Government Affirmative Action Fund asikobit kimuch keityin grupisiek chechang ak chepyosok chechang chemiten en mashinani asikobit komuch kotoretok en sobet nebo atkai tugul.
En kasarata nekosom MP Langat kanyoikab emoni koyan ng'alalet ak serikalitab emoni asikeit let kangelelchinetab boisiet netesentai kanyoik.
Takitariek kemoche kesom kelenjin kokoshin ak serikali amun kimoche kowek takitariek kobai kasit seretos bikyok ako kimoche kora kowek asikobit kotoret bikyok chechang. Ikere ngunon ile in private hospitals ko very expensive, kokokibet biik sana okase ngunon ketinye emergency situation in the country, mi floods, mi ne komi kasit neu nenyolu koyai takitariek. Kemoche kesom icheket ko compromise their position ak kowek and then kele ak ne serikali sikoker what it can afford.
Kotinygei yautikab maranet en Nairobi ak komoswek chenekityin komach MP noton biikab emet koribengei komoswek cheng'oen asikeistongei yautik chebo kabetetab sobet.
Ako kimoche kesom in our people keeku responsible, ko keker pichainik chebo biik chebunote karit kere kole kakonyi beek ainet akotestai kong'ete kokete karit across the river. Kimoche kenai kele mami any emergency nesire irib chito maisha neng'ung. Kotko kami kit nekemoe soret oldo age ikany kobet ropta korok anan kosubsiden so that you cross.
Kong'eten county nebo Kericho, logoiwekab emet chebo Kass, kainenyun ko Robert Siele.
Ako yuto kokakeit let nebo kayumetab logoiwekab emet kakibun eng orititab tetutieng'ung nebo tililindo rani. Kainenyu ko Chesankaro Sirma, testai ikere Kass TV, kimnatet night.
Kemiten kebeberta nebo Bomet kobaten ma Bomet inne kele ko Bomet kobaten kakimanda kidogo raini kelande akebe kechutosnetab Mau.
Nito ko tetutiet nebo betutab raini ko kabarastaet nebo agenge en agenge neitun kong'ete taunit nebo Iten en county nebo Elgeyo Marakwet.
Kokimiet master nekikonyo yoton. Kokamut baba konyo kalanchi kor kotebenan kole lemewe sukul alabat amwe kimamoche ale moseite amun kebarane komakiseita ko kit nebo biik cheosen.
County nebo Nandi ko kiokochini kanetisiet mongen ale towoe kuno tos kiotestai ako tos lene chemung'arainik.
Chamke chitab kalenjin nenu tugul ikere ketesinaton nebo Kass TV atinye kamang'unet ale baibai keng'eten oret nekararan kibwone agenge en agenge kong'eten county nebo Kericho.
Ng'emetab kalyet chemiten en komoswek chebo North Rift missing en kiwoto nebo Baringo County, West Pokot, Laikipia, Samburu, Turkana koboto alak komoswek chebo North Rift chotesa koityi koimutik chebo ripsetab kalyet.
Eng betutab raini eng tetutiet nebo Kass betut raini ameche kekushi kong'et tetutietab kabatisiet eng county nebo Elgeyo Marakwet.
Ole kibendi kenyoru ng'alaletab agenge eng agenge ak MCA noto bo waditab Chepkonyok eng county nebo Nandi.
Amatirustegei kora akot ndetinye kewelinwek mang'un amun sait age tugul koyotoksei koret.
Nyorun ketesiet nebo Kass FM International ak igerchigei kibindishek che kororonen mising betushek tugul saishek 24 kobun oretab musongnotetab kasari anan online app. Inyoru kora boroindo nebo inyorchigei logoiwekab emet ku kit neu koboto programs cheterter chebo radio ak television nebo Kass TV. Nam simeng'ung en nguni ak i-downloaden Kass FM International app in Play Store.
En tienwogik cherute yani tienwogik che moto
anyaliki murto yonde nyun yemi kimnatenyun
tienwogik cheistoun stress ako konin boiboiyet atkan ko tugul chuton tugul inyoru en tetutietab Kass tienikyok
chebo kolenjin
en Kass TV kila betut kong'eten Jumatatu akoi komut kasi kong'ete sait 11 ako sait 12 ak kebeberyat nebo koskolen. Komiten ak anendet Cheche 254 ak ane Cherotich Choti. Usikose.
Nito ko tetutietab tililindo ole inyorune logoiwek tugul chetinyegei ak kanyoiset cheboto kanetisiosiek chetoretin eng teretab mionwogik.
Immunization saves lives.
Immunization saves lives.
Immunization saves lives.
Immunization saves lives.
Mitei kamanutietab kikochi lagok chemengech chanjo kou ole iarorundoi ng'atutikab kanyoiset eng netoreti eng kirindaetab mionwogik cheimuch konam lagok chemengech eng kasarta neegitu.
Mamuch anyor chanjo ko aming'in ako ngami kenyisiek 5 anyor mgonjwetab polio nekikono kole mean kerenganikyuk sawendote tuguk chekitoretegei kebendoti. Amache asom sigik tugul chetinye lagok chemi kenyisiek 5 akwo ng'weny chetakomuchi kemut chanjo ale imut lakweng'ung chanjo sikirinde asikochi inendet komyeit bortanyi.
Ajere biik tugul chebo Nandi ak Kenya mzima ing wikinitoni nekibwoti kenyitab 44 kemwa kele obwal omutu lagok tugul kechanjan.
Kelen
vaccine saves life anan chanjo kokirindoi anan ko toretech kokirinda mionwogik. Ko chang boisionik chekeyoe asikobit kinet biikchok akobo ng'olyot neo nekilen vaccine saves, ng'olyot neo nekimoche kinet biik tugul akobo kanetetab chanjo. Ko kitinye ortinwek chechang chekinetishe, kimite oretab TV, kimi oretab radio, kikoitoi ng'alechotok. Kora kebendi korik en kot kora kikoitoi ng'alek chekineti biik akobo ng'alekab chanjo.
Chanjo inito ko kirindoi mionwogik cheterchin amu tomo konyor lakwet kimnotet ya kakisich neimuch kokirinda mionwogik neu nebo chebuonit, chebakitkit ak polio ak mionwogik alak tugul. Ko kong'ete kokakisich lakwet konyoru chanjo nebo chebuonit notok ko TB akotestai eng wikishek kora 6 konyor chanjo age keba wikishek 10 ak wikishek 14.
Yekait community health promoter korikwok asome ale sotach akoipchi ng'alechoto inetok ak otekelezan kora kuyoto kenetak ma ng'alekab immunization ichekei ako ng'alekab afya komugul ako yekarifanak okasit akobe facilities chenekiten.
Immunization saves lives.
Immunization saves lives.
Immunization saves lives.
Immunization saves lives.
Iker tetutietab tililindo eng Kass TV amu kimnatet naet.
Chamgei chitab kolenjin ako itagat eng uitul ole igere ketesiet nebo Kass TV atochin eng betutab rani asikobit keng'alale tetutikab bandab tai ako eng betutab rani kebendi keng'alale chametabgei ak tililindo ako kitinye kelchin kemitei ak Daktari Patrick Arap Kenei ne inyoise ine eng sipitalitab Kapsabet County Referral asikobit kinetkei eng betutab rani akobo miondo notok nebo seriat anan cancer ako amakitou tetutietab betutab rani ameche akonin boroindo Daktari Patrick Arap Kenei asimwoiwech ile tos Daktari Patrick Arap Kenei ko ng'o eng biik mising ko chemengenin.
Kongoi Cornelius, kongoi Kass TV akobo boroindo nekokono asikeng'alale ng'alekab cancer anan miondab seriat. Koyo kemwa kekureno Patrick Kenei. Patrick Kenei ko daktari clinical officer telelchini miondab seriat, kanyoiset ak chikilisiet en county nenyon nebo Nandi. Ako kongoi amu kemwa akobo miondab seriat. Amu miondab seriat ko legit kikogusan kila family within the country akot outside the country. Ko kito nebo maana keng'alale asikemuch kirinde mioni.
Kongoi daktari, kemwa ile itelelchini miondab seriat eng Kapsabet County Referral Hospital. Ako atebenin kityo daktari, tos mitei aina ngapi anan konyil ata cancer anan types chebo cancer?
Kongoi, kwanza cancer, mache kinetkei kele cancer ko ne? Cancer anan seriat ko mgonjwet netau ing cells ko choto ko sehemu nenyo nebo borwek chemengechen chemuch kotau ngot ko kinet kotaune kinet sehemu kidogo ako much koletegei kwa sehemu chechang chebo borto. Cancer ini ko tinye uwezo konam legit kamaswek chechang ing borwekab kimugulmet. Ekamwa ko cancer ne common anan cancer ne legit kekere kila ing hospitali nenyo nebo Nandi ko cancer nebo kinet ing chebiosok sana. Ako amache kora amwa kole akot boisiek koname cancer inoto kinet. Cancer nebo oretab kapsigis anan cancer nebo oretab kapsigis ing chebiosok, cervical cancer, komi kora tai amu legit kekere kila wikit case agenge anan aeng. Ing murenik ko legit kekere cancer nebo prostate anan cancer nebo boisiek ne tau ko kakere beek boisiek anan kou kowendi boisiek beek in several times and frequency komi barak. Cancer nebo oretab amitwogik anan kilen oesophageal cancer ko legit komi barak mising amu amuch amwa kora kole mako u trends ko mako u chikibe keny amu kijam kingen kele cancer inotok bo oesophageal cancer ko cancer nenome biik che echen chebo kenyisiek 50 kotestai, lakini amache amwaun ale of late kokeker akot lagokab kenyisiek 14 kotinye cancer inotok bo oretab amitwogik anan kilen oesophageal cancer. En kalenjin kolen biik cancer nebo chebororet. Kikonam kora akot tibiik chemelen kikere kele matinye risk factors chotok chemuch keng'alale ko baadaye ko legit komi barak kora mgonjwonotok bo oesophageal cancer. Cancer nebo bochet anan kilen bochet en kalenjin ko colon cancer mi barak kora ing boisiek kora ak chepyosok. Legit kamwa cancer nebo ng'ulielok komite cancer nebo korotik kikuren kalenjin leukemia anan Kiswahili Kiingereza leukemia komi barak kora ako legit kekere chotok ing hospitalisiek checho chebo Kapsabet anan akot Nandi Hills.
Kongoi daktari. Ako ameche ateben ale tos missing cancer che common ing bororietab Kalenjin ak Nandi County che okere eng Kapsabet County referral ko ingorcho?
Number 1 ing listit ko cancer nebo kinet ing chepyosok, cancer nebo kapsigis anan cancer nebo oretab kapsigis ak cancer nebo prostate nakaamwa awale le cancer nebo boisiek kokere beek ko legit komi barak kabisa chotok. So kosup ing number 4 ko cancer nebo oretab amitwogik nekile oesophageal cancer ko legit ko ngiro statistics checho ko legit ko kargei murenik ak kwonyik in terms of preference chekwai.
Kongoi daktari, kingen kele eng kasarta nekoi daktari ko kicham kobendi biik akoi sipitalitab Eldoret kochenge kanyoisetab cancer. Mangen ale eng Kapsabet County referral ko tos okere biik ata amu tai ko kibendi biik akoi sipitalitab Eldoret Chandaria. So ko eng Kapsabet chu komangen ale tos okere biik ata eng kila betut anan wikit eng arawet, maana ale tos ikonech statistics.
Kongoi Cornelius, amache amwa ale kong'ate kemuch kenyoru uwezo keyai chikilisietab mgonjwetab cancer eng Kapsabet kong'ate kenyitab 2018 ak ra ko legit kenyoru cases 8 ing wikit che mpya chebo cancer. Ngo cancer nebo kinet, cancer nebo oretab kapsigis anan prostate cancer ko legit ko an average of 8 to 10 in a week. Ako usuri kikemuch keyai all the tests nguno kicheru nekile biopsy, kimuch keyai CT scans chekimuch kenai kele kikoit ano mgonjwet, CT scans nebo staging. Kitinye kora MRI ako ketinye mammogram ing uchunguzi anan chikilisietab cancer nebo kinet ing kwonyik.
Daktari, mitei ng'oliot netebe chito kole kanyoiset nebo cancer missing ko kakonam chito koibe kasarta nekoi anan missing ya kakwo akoi stagit nebo 4 somok yo komi biik chelen makonyookse miondab cancer. Mangen ale koi daktari ak itinye naet missing kotinygei ak kanyoisetab seriat, tos iman anan une yoto?
Cornelius, iman amu cham kemwoe kila ak keketyini kila kelen ngenyor cancer komi stagit nemi ng'weny anan stage number 1 ko legit ko rahisi kinya ak kenya koistogei mgonjwet notok. Stage netai ak nebo oeng ko rahisi kenya keboisie oratinwek tofauti tofauti. Ngot ko oretab surgery, jam kulen biik oretab rotwet, oretab chemotherapy, kerichek chebune tikityot, ak kora oretab kanyoisetab radiotherapy koboisie x-rays kimuch kepel mionotok bo cancer. Ko on an average ko kararan kiketyini ama kichokeni kiketyini kora amu screening ko uwezo nekimuch kechikil mioni bo cancer kotokomi stagit kotom kotoi komie ako kararan amu kikere mionwogik cheu akot cervical cancer anan cancer nebo oretab kapsigis ko legit almost 80% kenyoru kotokomi nekile precancerous stage kinyoi mgonjwa noto koistogei completely ako makotinye tokonamin in future.
Mi daktari ng'oliot kora nemwoe biik kole miondab cancer komakeregei ak rotwet anan any surgery. Mangen ale koi daktari ko tos iman ng'oliondonotok anan lembechek tos kayanutik chekiyoni biik ako tos ngot koman ko ilechini ne bororiet anan biik chito nekerin eng nguni.
Kongoi kabisa amu ngot komi kit agenge namache amwa aka amwae kora ikan tugul ko ngomakiistoegei biikab kalenjin ng'oliondo nekimwoe kelen kale manamegei cancer ak rotwet ko legit ko notok inegei ne kikoibech keweke let mising eng kanyoisetab cancer amu number one ngot komi kanyoiset nekararan ako kanyoiset neimuch koiste mgonjwetab cancer completely or rather ne achieveni cure ing barak ing kiwango nebo barak ko kanyoisetab surgery amu surgery ko jam kulen biik rotwet ko tinge uwezo keiste ngot komi nguno kinet for example koka keborgei ing kiwango nekitigin ing kinet angeiste kiyoto completely akepiman baadaye keker kole makomi ko legit kenyoru kanyoiset nekilen cure kiachieveni cure ing kanyoisetab surgery so mamache kitikeiwai amu legit ko noto inegei nekikoibech let ing kanyoisetab cancer biikab kalenjin cancer kikochomyo ak rotwet amu legit ko biik chechang chekikobun kanyoisetab surgery ko legit kikosopcho icheket ma necessary akot sometimes ile ngaibun kanyoisetab surgery kotoko inyoru kerichekab chemotherapy malasima ing cancers alak amu ngenyoru kotoko stage nekitigin kuma lazima kekonin kerichekab chemotherapy.
Daktari, ako yoto ko ameche kebe kemwa ile agenge eng mionwogik mising anan cancer chemitei cheukere eng Kapsabet ako cheunyo eng county referral Kapsabet yu komitei miondo nebo cervical cancer. Mangen ale cervical cancer ko ngemwa kele cervical cancer ko ne ako tos konu ne mionitok?
Kongoi amache amwa ale cervical cancer ko cancer nebo oretab kapsigis ing kwonyik ako cancer initok le cervical cancer ko legit ko cancer ne rahisi kekirinda anan ngeboishe programs chechang chebo screening ko legit ko cancer number 1. Cancer initok bo cervical cancer ko kikenai kele ne nekoseni. Mi miondo anan miondo nekele virus nekele HPV virus. HPV virus ko legit ko at a rate of 90% ko koseni mgonjwetab cervical cancer. Ako mioni ba HPV ko kinamdagei through ing chomyet ing muren ak kwondo. Ako legit kabisa amu number 1 ngimuch kunyoru lagok cho vaccination HPV vaccine eng kenyisiek 9 ak 14 yo ko icheket kotinye uwezo manyor cancer nebo oretab kapsigis for the rest of their lives. So ngot komi cancer agenge nekekonu kurset kimuch kekirinde mising ko cancer nebo cervix anan kile cervical cancer. Ko ngonyor lagok cho vaccinations, complete vaccination 1 first dose ak second dose ko kirindoi icheket manyoru cancer for the rest of their lives. Amu ngiro nguno korotinwek cheu western countries, US, Canada, Australia and the others ko legit ko number 10 ing occurrence cervical cancer ko number 2 ing achek. So amu kikonyor icheket vaccinations for rather a good number of years back. So ui sikenyor icheket cancer nebo cervix number stage 3 stage 4.
Daktari, kongoi ako yotok miten ng'alekab risk factors. Ngele risk factors ko tos nyone anan kewelutik ngorcho chebwone o risk factors ak prevention chebo miondab cervical cancer.
Amuka amwa ale legit ko kikenai kele ne nekoseni cervical cancer anan cancer nebo oretab kapsigis. This virus ko HPV kinomdogei kong'ete muren ak kwondo. So oratunwek tugul netai ko ke maintainen ke reducen sexual partners, at least itinye chito partner agenge ne faithful. Nebo aeng ko kimuch kekirinda kuko kinet lagok cho kele malasima itau sexual intercourse in kenyisiek less than 18 years amu iboru kole biik che tau anan lagok che tau tabia nitok mapema kotom koit kenyisiek 14 ko legit konyoru icheket cervical cancer in oret ne rahisi. Kereducen kora sexual partners yekamwa netai. If you reduce sexual partners ko rahisi kimuch kekirinde mionoto ako akenyoru vaccinations as provided by the Ministry of Health. First dose, second dose ing lagokab 9 years to 14 years ko rahisi kora.
Daktari, mitei ameche ketokchigei kanyoisetab miondab seriat. Kingen kele mitei kanyoisetab miondab seriat ako mising komitei ng'alekab stages. Mangen ale ngutos kinyoitoi ano mionitok bo cervical cancer ako tos kinyoi mising ko kakoi stagit ngoro ako cham kekose kora kelen mitei surgery nepkicheru rwondo mo. Mangen ale tos toreti notok kokirinda letaetab kei nebo miondab cervical cancer.
Kongoi Cornelius, cervical cancer ko tinye stagesiek ku mionwogik chechang chebo cancer. Mi stage netai, stage nebo aeng, somok ak ang'wan. Ngemwa kele stage netai ko stage nemite mgonjwani legit komi yutok tom koletakei kong'ete oretab kapsigis. Stage nebo aeng ko iboru kole kiko nakta ing oretab kapsigis kidogo ako tom koit ng'ulyelok. Stage nebo somok ko iboru kole kiko letakei kikosir oretab kapsigis ak kikoit ng'ulyelok akoit kora loletab beek anan kilen bladder anan oretab amitwogik ing let yun. Stage nebo ang'wan ko kikoletakei ing yoto mi anan kilen kikoletakei ing oretab kapsigis akoistegei kwo kamaswek tofauti kou koito, kou bwonik anan akot brain, for example konyita anan kilen ko metit. So ing kanyoisetab stage netai ko legit keyoe surgery nekakimwa netai, operation keiste rwondab mo ak keiste oretab kapsigis ko complete. Ko notok ko percentage nebo cure komi parak mising kosir stage nebo aeng, somok ak ang'wan. Stage nebo aeng, somok komi kanyoisenyi kora, melen kimwoe kele mami kiy nekeyoe. Mi kanyoiset nebo chemotherapy ak radiotherapy. Chemotherapy ko kerichek chebune tigityot chetinye uwezo kobun korotik ak kobar mionotok ing oretab kapsigis. Radiotherapy komi kora amu kiyoe ing combination sikosich keng'et kepel cells chikai pa cancer ing oretab kapsigis. Ako mi kora kanyoiset nebo mwisho nekilen palliative care. Ngumakomukakse kanyoiset age kou surgery, kou radiotherapy, kamuch kora kinya mgonjwa ini keboishe kerichekab chemotherapy simatokoletakei ing yemite.
Kongoi daktari akobo kanetisiet notok kakikonech netinye ak miondab cervical cancer. Ko chitab kolenjin ameche kebe break nenwach asikeweke ketesta ak daktari Patrick Arap Kenei kobun sipitalitab Kapsabet County Referral Hospital nekakotestai konetech akobo miondab seriat ako kale mi kamang'unet mising angot matiny kakonamin miondab seriat komi kamang'unet nebo kinyain ak isop ak itestai ak sobeng'ung nebo kotugul kiweksei komalo.
This April, your kids deserve to enjoy non-stop laughter and entertainment for the holidays. The Salulu is to recharge your subscription and get upgraded to the next high bouquet on Star Times to enjoy a never-ending lineup of fun shows on our fantastic kids channel.
I'll take it from here. Sam, shoot the ball.
Join Teeny and Tiny as they teach wonderful lessons on Baby TV. Make new friends with the Roblox Rumble Gang. Join Inspector Gadget as he solves puzzles on Cartoon Channel. Save the world with Ben 10 on Boing TV or learn the wonders of science on the Da Vinci Channel. Recharge on your current bouquet and get upgraded to the next high bouquet for 1 month. Download Star Times on app for unlimited entertainment. Anytime, anywhere. Star Times. Enjoy digital life.
Lakini vile hii ekonomi imetufinya, ilinibidi kubadilisha sabuni nikatumia ingine rahisi. Bala, ilibidi nioshe kila kitu mara mbili. Sikuwa na otherwise, nikarudia Ariel.
Ariel, usafi bora kwa mwosho mmoja.
Nito ko tetutietab tililindo ole inyorune logoiwek tugul chetinyegei ak kanyoiset cheboto kanetisiosiek chetoretin eng teretab mionwogik.
En kainutik kekuron Charles Arap Cheriot, daktari nebo nenyoe mionwogik nebo makatet, kimwoe en kutitab chumbek kele dermatologist. Abunu kebeberta nebo Bomet, Texas Schools Medical Center nemiten kebeberta nebo Chebole ak inyoe mionwogik tugul chebo makatet, siok ak sumek. Ak boisiet neo mising nekiyoe ko biik chechang cheimegei chetindo mionwogik chebo makatet, chetindo tuguk chekutkutenigei en makatet anan ko netindo mionwogik chebo sumek, chetilokse sumek anan kong'wori sumek anan ko tuguk chekisire sumek, ak biik chetindo kaimutik chechang chebo siok choton komuche ko kakowalak kalait anan kobwone tuguk chekarut anan ko kakowalak kalait, ko noton boisiet nekeyoe en kebeberta nebo dermatology. Biik chechang komaikuitos kole miondo nebo makatet ko tindo kaimutiet neo ako moingen kole miten kebeberta nebo iririot inegen. So kimwoe kele biik chekanyor kaimutik chebo miondo nebo makatet anan ko sumek komiten dermatologist anan biik chekisomonji makatet inegen anan ko iririot chemuche kosolven anan konyor kanyoiset nebo makatet. Miondo neo mising nebo makatet ko nebo kukutkuten makatet anan kukutkuten iririot chito. Biik chechang kotindo kang'waretabgei en kutit nebo kalenjin ne moingen kole imuche konyor kanyoiset. Mi kora tuguk chewolokse kou en neranik ko chang tuguk chewolokse kou cholelen ngosenik kobwote biik kole mondoi kerichek lakini kitindoi kerichek. Mi kora mionwogik cheter chemuche kowolokis makatet kolelit ko mara kotam ko kararan komuche kowolokis makatet. Mi biik kora chechang mising che ityech chetindo miondo nebo keldebesiet ng'weny ne biik chechang koibe kasarta neo komwete lakini tindo miondo nebo fungal ne maikuitos biik kole tonyolu kokere dermatologist. Mionwogik chechang chebo lagok chemengechen konyoru lagok chemengechen ako kutkuteni anan inome koborugei en togoch. Chepyosok chechang anan kamatik kobwote kole kasochi chego, ibwote tuguk chechang kole kakiker biik cheterter, lakini miondo nebo makatet konome kotoko arawek aeng anan ko arawek aeng kokakisich lakwet komuche keker konam kobiririt toget ak konam koutut anan komabaibai lakwet anan koyome mising iririot nebo lakwet. Miondo nebo iririot anan ko makatet ko miondo neu miondo age tugul ako nemuche kokon kobos quality of life mising anan koimgei biik koboisien rabisiek chechang yon manyor specialist nebo makatet akot komuch konyor kanyoiset anan kanetisiet neo koter mionwogik chebo iririot anan ko makatet. Miten mionwogik chemainyookse che ngobwa biik ki-adviseni kelenjini inoni keribe kityo amun miten chekikisiktoi biik, miten chemaistogei, miten che korom kabisa kostogei. Lakini at least kekochini relief anan advice nemuche kotoret. Ako ki-adviseni biik anan king'ololchini kelenji kararan yon kasib konyor dermatologist anan ko specialist nebo mionwogik chebo makatet anan ko iririot asikimuch keter mionwogik chotet. Kainenyun ko Daktari Charles Cheruyot ak ikere Kass TV tetutiet nebo tililindo.
Testai iker tetutietab tililindo en Kass TV amu kimnatet naet. Itagat kokeny chitab kolenjin asikobit ketestai ak ng'alalenyo nekimite ak Daktari Patrick Arap Kene kobun Kapsabet County Referral Hospital nekakonetech eng kebeberta netai kotinygei ak miondo nebo cancer missing ko nebo cervical cancer. Ako eng kebeberitak bo aeng ko kemeche kenyoru daktari kora asikonetech missing akobo miondo notok nebo seriat nebo prostate cancer. Ako daktari ameche atebenin kityo ale tos prostate cancer ko ne ako konu ne ako missing eng Kapsabet County Referral Hospital biik cheokere percentage neo ko tos biik che echen anan che mengechen anan chebo umri wakati. So daktari tagat.
Kongoi kora Cornelius Babarai kekono sikeng'alale miondab prostate cancer. Netai kotom kenai kele prostate cancer ko ne ko lazima kenai kele prostate ko miono ing bortab muren. Ki saisinyi kou lakwasiat ko ngobun rogoretab beek katikati nebo kii ngoet kii anan this prostate ngoet koetu kochile beek anan chile rogoretab beek simabwone beek komie. Ako legit ko tuguk somok choe prostate ni koet. Netai ko etundo anan kilen ngakoet chito kowendi koetu this gland, this prostate. Nebo aeng ko cancer nebo prostate. Nebo somok ko infection anan kilen inflammation nebo this prostate nikile prostatitis. Ko legit ko somok che legit ko common causes nebo kii koet. Legit ko miondo netai anan miondo nemi barak ing murenik. Especially murenikab Kalenjin amu ngiro mionwogik alak cheu cancer nebo oretab amitwogik, cancer nebo colon cancer anan nebo bochet ko legit ko prostate cancer komi barak. Ako legit ko kabarunoik ko legit mut loyo. Netai konyone chito kolen ngae beek komabeku ing loletab beek. Agenge kowendi chito beek safarishek chechang. Mu kole chito wendi beek safarishek mut anan lo sikoech. Nebo somok ko lechinin chito ngae beek kongwonen anan imuch koburuktagei korotik. Nebo angwan ko inyoru chito kolen kikwama suet ing muda neo. Kolen age bwone beek ui atau ae beek ako ui kora atere ae beek. Aga kolen beek chebwone ako isoitoi. Nakate bwone beek ko bendi konoktoi ing borto yuto kobendi kosochin ng'ony yutokyu. Ikan tugul inyoru boisiek kolen ngawe arete beek ko baadaye anyoru nguriet kakonun inegei. Kembo kora bichu kolen ngastukenjini kitongon kakoech komi beek nguriet. Alak sikaker ing of late kolen murenik especially murenik kitokomuchi kwai kasitab family kolen chito kikwo ng'weny kimnatetab kiume. So legit ko chotok chekamwa ngot komi chekautie ko legit ko chotok ko majority ing kabarunoik. Ne nikeyoe anan ne nemuch keyoe ko muren
Amaita igone chilene negaitos miondab seriat koname prostate cancer. Kotos name kora lagok chemengechen anan neranik?
Kongoi Cornelius, netai ko mioni po prostate ko legit ko miondo nebo boisiek. Ingawaje ko mi kora biik chetinye umri che legit kenyisiek 45, lakini sana ko murenikab kenyisiek 50 kotestai anan kenyisiek 45 yo kotestai 70-80 years komi chito ko legit ko chang icheket chebwone ak kabarunik cheu chotok. Ako ui sinyoru lakwet nebo kenyisiek 20 anan kijanaat nebo kenyisiek 25 ui sinyor kotinye inendet mogonjwetab cancer nebo seriat nebo prostate.
Mwae chile tos ne nekeyoe asikobit kekirinde miondab prostate cancer anan prostate cancer.
Kakemwa ile tos ne ibu mgonjwa nebo prostate cancer. Legit ko running families. Ngot komi chi ngui murnetab 40 years, 45 years, ko magat inai family history nengwong. Ngot komi chi nekikotinye prostate cancer anan kikidiagnose prostate cancer ing lainda nengung no tupche anan baba nengung ko legit kora corona ning those families ko magat isichikilgei eng kenyisiek 45 kotestai. Borwek anan obesity, borwek cheechen ko legit kora ko ibu mgonjwa nebo cancer nebo prostate anan jam kelen lack of physical activity. Ngomakimuchi keyai boisionik chekibirtoi borwek komuch konyo mgonjwa nebo prostate cancer.
Tos kinyoito ano anan kikirindoito ano korok kamait kinya mgonjwa nito?
Kimuch kekirinda mioni bo prostate cancer ko ketau ko murenik keyai boisionik kebirte borwek cheechen ak kemuch kora keker tuguk chekiame sikimuch kekirinde mioni bo prostate cancer. Chikilisiet kora ngot ko kamwa ale magat inai family history nengung. Ngot komi chi netinye prostate cancer eng lainda ngung nebo family ko magat isitau ichikilgei eng kenyisiek 45 kotestai sikemuch kekirinde mioni bo prostate cancer.
Daktari mitei biik cheibwotyin kole manachi miondab prostate cancer eng Kapsabet County referral komitei kasarta agenge nekikakibwa yundok ako kimitei bakornatet nebo biik chekikosobcho eng miondab prostate cancer. Ko tos missing prostate cancer neinyooksei ko kakoi stagit ab ata?
Cornelius, ngo amache amwa ale prostate cancer ko miondo nelegit nerahisi kinyoi ako miondo ako ndami stagit nebo 4 kimuch kekirinda komatokoletegei ko stagit nemi koletegei missing ing yemite ako survival rate nebo prostate cancer komi barak compared to cancers alak. Ngisub nguno prostate cancer cancer nebo oretab amitwogik anan ngelen esophageal cancer akot ngenyor ko stage nebo 4 ko kanyoisenyi kimuch kinya ako much chito kwo kotar kenyisiek 5 anan kenyisiek 10. Kitinye survivors chechang chebo prostate cancer ako legit icheket chikebendi ikan tugul ketinye boisionik ko icheket chemwoito kole cancer ini ngenyor ko mapema konyoekse ako malasima kebe kerichekab gaa anan malasima kemwee kerichekab sipitali.
Kongoi daktari ako yotok taban ak miondo notok nebo prostate cancer kwameche ketokyigei kakemwa eng tai yo ile miondo kokeny anan seriat kokeny ne missing ko common eng county nebo Nandi ak Rift Valley anan ko neonyoi eng Kapsabet County Referral Hospital ko notok miondo nebo seriat nebo kinet breast cancer. Ko tos breast cancer ini ameche kengalale yotok ale tos breast cancer ini kone ako tos konu ne miondo breast cancer ak kenae ne kele tindoi chito breast cancer.
Kongoi Cornelius, breast cancer anan seriat nebo kinet ko legit ko ing occurrence nenyi komi barak mising ing cancers tugul chakamwa. Breast cancer ko tau ing kinet ako legit kabarunoik chik ko chang legit 5-6. Netai konyone chito kolen kiaker ki ing kinet ki namugul ing kinet neetu netesetai koetu. Ab kole chito mite kianyoru ng'ulyelet ing kinet ako tesetai koetu ng'ulyelana amang'wan. Alak kolen kinet, kutitab kinet kowek kokirilet anan cham kelen nipple inversion. Alak kolen kiet kinet agenge kosir age. Alak kolen kiwalak ngositab kinet kobiririt ako kosich tuguk chu konyik anan kilen tuguk cheu kong'ik ing kinet. Ako alak kolen kianyoru ki neo ing kinet kiabwotini ko pengine abscess anan kilen ngalenyin cham kelen ondiriet. Sana ko confusion biik kunoto kilen ondiriet. So chang kabarunoikab cancer nebo kinet. Kamwa che legit 4-5 lakini chang mising. Age kora ko beek anan korotik chebwone eng kinet chama legit ko chito nemenyonyishin lakwet kobwone korotik.
Tos kaimwa akobo kabarunoik chebo miondab cancer notok. Tos miondab breast cancer miten ng'alekab risk factors chebo miondab seriat nebo kinet. Mangen ale tos ngorcho ako tos kiai ne asikekirinda mionitok bo breast cancer.
Mioni nebo breast cancer one ko miondo nehab korona ning family kora. Ngot komi chito nekitinye cancer nebo kinet ing kenyisiek chi, ngot ko notupche, ngo i chepto notupche ako tinye cancer ing kenyisiek chemengechen anan less than 30 years, komi genes ab chikeinheriteni chekile BRCA1 and BRCA2 genes ko chotok che legit kiinheriteni. Nebo aeng ko borwek che echen, obesity. Sana konyone because chito maimuch kwai exercise nemaktayat. Ng'alekab amitwogik kora, amitwogik chekikeam che legit kokonu borwek koechekitu. Ng'alekab maiyek ing chepyosok anan akot murenik, ng'alekab kora tobacco, smoking, ko legit ko chotok chekonu mioni nebo cancer. Age kora ko ngolegit ko isich chito radiation anan kikeyun radiation previously ko legit inyoru miondab cancer nebo breast.
Daktari, mitei missing konyoisetab breast cancer ko ngap kwa chito kot ketil kinet, mangen ale tos chances anan amune sikoit ketil kinet ako tos chances chechiket chebo kusop akotestai ak sobenyin nebo kotugul kwata.
Ngenyor chito kotinye ki nemugul eng kinet, netai ko mi tuguk chekeyoe, kimwoge akecher bendo akepiman. Ngepiman mionoto ko iboru kole mi cancer anan mami cancer. Malasima ngomi ki nemugul kinet ko cancer. Mi tuguk chechang cheibu komugulit kinet. Akot TB, amu I was surprised kimi chito nekimuch kebwat ko cancer inendet, lakini ko cancer nekimi kinet lakini kiwalak ko TB ak kikinya ing kerichekab TB aketar mogonjwa noto. Amache amwa ale ngakenyoru kele cancer ko keboisie biopsy, kyoe staging keboisie mashinishek chekile CT scans and akot MRIs sikenai kele kikoitano. Stagit netai, nebo aeng kemuch keyai surgery. Surgery ko keiste kiyoto mi kinet sokosub konyoiset age neu chemotherapy ak radiotherapy kora. So konyoiset nebo keiste kinet kotoreti eng kiwango neo kemuch keiste anan kinya mgonjwet noto koistege completely. Amu isubi kora mi kerichek chekekoitoi chebune tikitiot chekele chemotherapy, komi kora chikile radiotherapy cheisubi ko baadaye.
This April, your kids deserve to enjoy non-stop laughter and entertainment for the holidays. The Salulu is to recharge your subscription and get upgraded to the next high bouquet on Star Times to enjoy a never-ending lineup of fun shows on our fantastic kids channel.
I'll take it from here. Sam, shoot the ball.
Join Teeny and Tiny as they teach wonderful lessons on Baby TV. Make new friends with the Roblox Rumble Gang. Join Inspector Gadget as he solves puzzles on Cartoon Channel. Save the world with Ben 10 on Boing TV or learn the wonders of science on the Da Vinci Channel. Recharge on your current bouquet and get upgraded to the next high bouquet for 1 month. Download Star Times on app for unlimited entertainment. Anytime, anywhere. Star Times. Enjoy digital life.
Nyorun keteshet nebo Kass FM International akigerchigei kibindishek che kororonen mising petushek tugul saishek 24 kobun oretab musoknotetab kasari anan online app. Inyoru kora poroindo nebo inyorchigei logoiywekab emet ku kit neu koboto programs cheterter chebo radio ak television nebo Kass TV. Nam simeng'ung en nguni aki downloaden Kass FM International app in Play Store.
Kimoche ngalek chebo itik ak kastaet koek ng'olyon nemoche kinde kamanut ak kenam chi tugul nemi kokwet age tugul konyor ole imuche konyae itik chik ngotinye shida neunoto. Ng'olyon nekitinye betutab ra ko kemwa kele ongetoret boisiek, ongetoret chepyosok, ongetoret akot gogo. Ak ongetoret akot agui amu choto cheime mising itik. Ako mising ye kakenyoru toretet nebo boisiek ak chepyosok kekakela toretet nebo lagok chemengechen.
Mi families che ngap kotindo shida nebo makase komie. So nekisiche chito imuch kesich chito komakase. Ak mutai kora kosich chito age nemakase. Another ng'olyot age komuch koik mionwek cheu meningitis anan iboisie chito kerichek chemasirchi daktari neingen akobo itik che imuch kokon kewelutik eng kasetab chito. Ng'olyot age ko ya managat mama konyalu kwo clinic nebo kina mama sikobit keyochi tuguk chekikure immunization ak kisub akoi kosich lakwenyi kochamegei.
Mi uindo neo mising amu komakasta lagok then we'll end up having ketinye in ng'alekab deaf schools. So komakimeche keit yundo ngiwe ematunwek alak chekikotestai kekere kele kikeker even the deaf schools. So kemeche keibu kiyoto konyo Nandi oli.
Kenyit agenge kokokyai pilot study eng county nenyonet ako akoi yekimite saizi kokokeskirinen lagok 3,650. Ako eng lachoto kokeskirinen kokokenyoru lagok karibu 70 chekokobor kole tindoi kewelutietab kokas. So kitesetai keyochini investigation ak kesome county nenyonet in the near future angot keker kele kakiproviden tuguk cheu hearing aids sikobit kotoretok lagok cho. Matekeuny lagok chemakase anan biik chemakase, kimeche kimong'u lagok tugul sikobit kotoretok.
Testai iker tetutietab tililindo eng Kass TV amu kimnatet naet.
Itagat kokeny chitab Kalenjin kakeweke eng kebeberta nebo somok ako nebo let eng tetutiet no nekang'olole betutab rani tililindo ak chametabgei. Kemitei ak Daktari Patrick Arap Kenei kobun sipitalitab Kapsabet County Referral Hospital ne kakonetech eng kebeberta netai ak kebeberta nebo oeng kotinygei ak miondab cancer. Ako kebendi kebeberta nebo somok ako nebo let ko daktari ameche ateben kelcho ale tos kewelutik ngorcho chobune ko kanyoik chonyoi miondab seriat eng county nebo Nandi ako tos une uptake nebo HPV vaccines mising ko chekikochin tibik eng county nebo Nandi.
Kongoi kabisa Cornelius. Challenges chekibune ko kanyoikab mogonjwetab seriat ko netai ko kimuchi kichikil chito akenyoru kotinye stage nebo cancer, stage netai nebo cancer. Ko chichotok kerichekab gaa ngowekse komi stagetab 4. So challenge no ko biik koba kerichekab gaa sikowekse komi stagit nebo angwan anan nebo somok. Kora komite challenges chebune biik amu biik kotokotinye kabwatutik cheyach chelen biik kiywei ketiny miondab cancer. Ketiny in the sense that kinem bendo ay much kepiman ngot komi cancer inoto iman. Challenges kora ko legit tom konetkei biik, tom kinet biik mionwogikab cancer. Amache amwa ale ngot komi kii nebo maana mising ing sae ing serikalitab county anan ko serikalitab national ko magat kinet biik ing barasaosiek, magat kinet biik ing kanisosiek, magat kinet biik ing forums age tugul chemuch kinyor biik kinet akobo miondab cancer. Challenges chito komi kora ko challenges chebo biik che cham kolen kalya kemakene kiy nekoruchingei. So magat kewal kabwatutikab biik sikomuch koimpresen ng'alekab chikilishetab cancer. Tokomi ng'weny kora vaccination nebo HPV ing lagok 9 to 14 years. Magat ke-encouragen lagok cho imeken sure sigindet ngitinye chepto ing gaa netinye kenyisiek 9 ak 14 ko magat imeken sure inyendet ile kakonyor inendet vaccination against HPV sikomuch inendet komanyor cancer ing sobenyi tugul anan cancer nebo oretab kapsigis ing sobenyi tugul. So amache amwa ale screening tom ko impresen biik ng'alekab chikilisiet. Magat ke-encouragen biik komong ing chong'indo sikomuch kochikilgei icheket akonyor sikomuch kenyor mogonjwetab cancer kot komi stagit netai anan nebo oeng sikobit kinya ing kanyoiset neitunayat. So abwati ale chotok cho atinye ko challenges chekibune biikab Nandi ak kanyoik kora chebo Nandi.
Daktari, kebendi kiwang'u ko tos success, what are some of the success stories che tos omwa ole takokoite kanyoiset notok nebo miondab seriat eng Kapsabet County Referral? Ko tos omwa ole kikeib kakwautik chu ako tos otokchinigei ano ogeregei ole tos obendi eng kenyisiek chemite tai anan betusiek chemi tai ko tos obendi anan ogere ole obendi okoitoi miondo kanyoiset mising kosir the 4 types or 5 types chekaimwaiwech?
Kararan Cornelius. Netai kingetau ng'alekab devolution ko kimakemuchi keyai akot investigation agenge nehusianigei ak miondab cancer. In 2016-2017 kikimuch kenyoru kanyoik chekikomuch kwai icheket post basic diploma ing ng'alekab kanyoisetab cancer. Betusiek choto tugul nguno kikemuch kicheru biopsy, kikemuch kiyokte ipkepiman, kikemuch kitau kanyoiset nekile basic chemotherapy nyikimokomi, kikemuch keyai staging nebo cancer kebun CT scan secho ing Kapsabet County Referral, kikemuch kechikil miondab cancer including akot cancer nebo prostate. Kimukemuchi keyai akot simple PSA ing wakati noto. Kikimuch keyai mammograms chekimokomi. Ako kora ngiro ketinye survivors chekibendoti tugul chekikobun icheket eunekcho kong'ete diagnosis akot koit konyor kanyoiset akomi icheket nguno komwoitoi uchumbe chelen cancer ngenyor ko mapema konyoekse. So that is the only encouragement nangen ale mi biik chechang chekikobun eunekcho chekikemuch kirifan konyor treatments chemakitinye as far as Moi Teaching and Referral Hospital, as far as Kenyatta Teaching and Referral Hospital, akot Kenyatta Teaching and Referral Hospital chekamwa ko kikimuch kiyokte icheket ak kikowek icheket ko survivors. So encouragement nenyu noto.
Mitei daktari kanyoisetab miondab seriat ko eng kasarwek chechang ko kikiro ak kikebaorionchi akot eng kokwatunwek alak biik chekikwalda malikwak sikobit konyae chamanikwak kekur harambee kiai mchango asikobit kinya biik anan chi netindoi miondab seriat. mongen ale ngu tos naet nemotindoi bikyok kotinygei ak ng'alekab kadisiekab NHIF, tos kavani NHIF kanyoisetab miondab seriat, ako tos how expensive is it kinya miondab seriat akoi ipkobek eng chito, ipkosop chito?
Amache amwa ale for real NHIF kong'ete diagnosis ak treatments akatugul, ngotko treatment nebo chemotherapy, ngotko treatment nebo surgery, ngotko treatment nebo radiotherapy kwae NHIF. Ako protocol nenyo anan rules checho chekikeyai ngotko itou kityo koketau kanyoisetab chito anan koketau suspecten ile tos tinye chichi cancer, ngometinye kadit netai ko lazima kiyokte ipkotil katitab NHIF. Amu kingen kele NHIF ng'ate 2018 ko tare kanyoisetab cancer. So ngometinye chito NHIF kaikai abwati ala in the next few coming months ng'alekab social health insurance cover ko legit ko mandatory in kila jamii and kila family konyor NHIF. Biik chetokolda mali ko problem ko naet. Nakamwa ale ngot komi kiy neo mising ko kinet biik cho kuhusu mionwogikab cancer ak mionwogik alak chebo chronic diseases, diabetes, hypertension, HIV. Nebo aeng ko kinet icheket komuch kotil cover nebo NHIF amu legit malasima ialde tuguk akobo cancer makou keny amu sai ko coverni from diagnostics to treatments. Akot agere regulations chebo SHIF kora ko len palliative care, that is palliative and end of life care ko cover ni NHIF. So magat ke impresen magat kinet biik kotil NHIF cover.
Kiwangu tetutiet daktari ko ameche akonin boroindo manole ngu ng'olyong'ung nebo let ak icher meng'ikab county nebo Nandi ak bororietab Kalenjin eng koi tugul ole kerenin ak ole kasenin eng betutab rani.
Parting shot ko ongebwa ing chongindo kechikilgei miondab cancer. Legit ko hospitalisiek cho tugul, sub county hospital, county referral hospitals ko legit kotinye uwezo kochikil miondab cancer. Cancer ngenyor kotoko mapema, ajam kolen biik mapema ndio best, konyoekse. So parting shot ko mapema ndio best.
Mapema ndio best. Noto ko Daktari Patrick Arap Kene kobun sipitalitab Kapsabet County Referral Hospital eng county nebo Nandi. Nikakonetech mising akobo miondab seriat, ortinwek chekikirindoe, kanyoiset ako ng'olyonyi neo ko ngimong'ugei asikechikilin komuchi inyoru kanyoiset ak isop ak itestai ak sobeng'ung nebo kotugul kou alak chekikonya ine ako kikosopcho. So chitab Kalenjin ako yoto ko kakitlet tetutiet notok no betutab rani nego kitinyegei ak ng'alekab tililindo ako yotok ko amagun kit age tugul nemie testai ker ketesiet nebo Kass TV amu kimnatet naet.
Nito ko tetutietab tililindo ole inyorune logoiwek tugul chetinyegei ak kanyoiset cheboto kanetisiosiek chetoretin eng teretab mionwogik.
From the tests that we've run, from what we've seen, both of us, you are HIV positive.
That's how it started. Nestled along the serene shores of Lake Victoria, in the heart of Homa Bay County, our story unfolds. Here in this picturesque town, life takes on a rhythm shaped by the waters that have witnessed generations come and go. Amidst the bustling streets and vibrant markets, we encounter faces of courage, resilience, and determination. Meet Sinters, a pseudonym she chose. an 18-year-old mother living with HIV. With a blurred face, she bravely shares her story.
This one guy, he used to tell me that he loves me so much. I was just informed too then, due to this peer influence, that you see your friends are doing certain kind of a thing and you are among the friends and you're not doing it. So I decided, let me just give in. When we got together, I didn't know the status of this person. I asked him, can we go and know about our status? But he said, it's okay. Maybe we can use this one for self-test, using the self-test kit. So I agreed to it. He went and did it alone. I didn't know how it was being used. And he brought the results showing only one strip. So I knew maybe this is the right thing. So I decided to give in. And that's how it went. Then after some time, the guy left me. And I really wondered, why does he just have to leave me after all this? But it didn't come into my mind. I just continued my studies. I was just participating. Then all of a sudden I started hearing that I'm sick, I'm often sick. So without informing my parents, I decided to go to the hospital because sometimes I used to cough and I vomit in the morning. So I decided, let me go to the hospital. At least these people will test and know what is it.
Cynthia's journey began with a revelation that changed her life's course. She discovered she was not only pregnant during her teenage years, but also HIV positive.
The doctor told me that I have to start the clinic. So I decided, okay, it has already happened. Nothing I can do. I can't abort because since I was a child, I was told abortion is a crime. So I decided, but one thing that I kept in mind is that how will I face my parents? How will I tell them? Especially my dad, who is really harsh. How will I face him? But I said, let it be. So they told me I have to start clinic. And there, for you to start a clinic, there's some other tests you need to do. So they wanted to do some tests. One of them was HIV. The test was done. Was part of it that again I was HIV positive. Yeah. They talked to me, they advised me on what to do. And there they gave me the drugs, the ARVs to start using. And from there, I decided, okay, it's fine. That's who I am. This life, I'm the one who have chosen it because I'm the one who decided to do what my fellows are doing due to peer influence, due to peer pressure, the negative one, which didn't help me. So I went ahead. I took the drugs. But what was ringing in my mind was, how was I going to kill myself? I wanted to commit a suicide. That's what I wanted to do.
The United Nations AIDS 2022 data underscores this reality, that over 860,000 Kenyan women aged 15 and above are living with HIV. The past year alone witnessed around 13,000 new HIV infections within this group. And by the end of 2022, the number of AIDS-related deaths among these young girls reached approximately 8,500.
My dad became so mad He was shouting all over the compound that I have ashamed him. I'm good for nothing, daughter. I've done the worst thing. So I just had to bear it. So from there is where he told me that paying for your school fee, you've decided to be a mother. You relax. I have some other children, many. So let me handle them first. Let me pay for them school fee, they study. You, because you are now a mother, you are a grown-up, you relax. It was really hard on my side, but I just have to bear it because it was all my fault. Yeah.
The harsh reality of HIV infection among adolescents is staggering. These statistics represent lives, stories, and challenges that demand our attention. Teacher Daniel Obondi and Dr. Winnie Ochoro shed light on the triple threat effect, revealing the complex web of factors that young women like Sintas are facing.
The issue of maybe teenage pregnancy, it has been so common, especially the last 3 years we have been experiencing this problem. It's like they are exposed to the matters of sex and they engage in unprotected sex. That is why it results to earlier pregnancy. And number two is the issue our students here, mostly they are exposed to the issue of disco matanga. It's very common around. Disco matanga is very common, that at night they can go, they participate in disco matanga, and you know what happens by the end of that exposure. They will end up maybe doing sex with those that they are participating with. It's very common around, and that one also makes them to engage in premarital sex, hence getting pregnant.
Most of the time you get like challenges like the pregnancy, even the HIV has come because of the social background that this lady is in, like school fees, buying these small things like sanitary pads. Yeah. So usually it's the poverty that leads them to having a boyfriend, or maybe running to marriage, the early marriages that we have around. So it is just poverty that leads them to these things. So they go there ignorant, knowing nothing. So they just get into sexual, in fact, unprotected sexual intercourse.
From the serene shores of Homa Bay, our journey takes us to the bustling streets of Nairobi, the heartbeat of Kenya. Here, we delve deeper, seeking insights from dedicated professionals who make a difference. In a clinical psychology office, we find Faith, a compassionate psychologist from Chiromo Hospital. She sheds light on the common challenges faced by those battling HIV, where thoughts of isolation and despair often loom large.
Someone diagnosed with HIV and AIDS might experience symptoms of depression. For example, feeling worthless, feeling hopeless, feeling like their life has come to an end. It's a death sentence. And of course, this is based on the information that was there in the past. But currently, treatment has really advanced, and now people are able to get, medication, and they're able to actually live healthy lives. So because of this effect of, or the mindset that one has, that once I have this diagnosis, then my end goal is death. So they end up starting to get affected psychologically, and they experience negative thoughts. One of them now being those feelings of hopelessness will lead to suicidal thoughts.
Our pursuit of understanding leads us to Elizabeth Glacier's Pediatric AIDS Foundation in Nairobi, where dedicated team stands united in their commitment to support those living with HIV.
Adolescent girls and young women specifically suffer a lot of stigma. These are the same women who have high rates of pregnancy. In Kenya, about 20.4% of the women presenting to our clinics are adolescent girls and young women. And so in the setting of HIV, with the intersection between the adolescent period, the mental health vulnerabilities, self-stigma and social stigma as a result of HIV infection, we find that a lot of, especially pregnant adolescent girls and young women, are not being retained in care. What that means is that they can be seen in the clinic and initiated on treatment, but many of the time they are getting lost to follow-up, or they are not taking their antiretroviral treatment well, and this is really contributing to the maternal to child HIV transmission, specifically in this population.
Through empowerment program and community initiatives, they strive to shatter the chain of stigma and create a future of hope.
One of the determinants of high HIV prevalence has been the social structures that our adolescent girls and young women are exposed to. You may have heard about the triple threat, and this is really a term that brings together social determinants that really lead to poor health and social outcomes for adolescent girls and young women. And this really includes early teenage pregnancies, exposure to sexual and gender-based violence, and also high HIV infections amongst our adolescent girls and young women. Having recognized this triple threat, as an organization, we have responded to it, and we have developed innovative strategies to really address the triple threat amongst our adolescent girls and young women. One such strategy is a project we call Girl Power, or G Power, and this project really utilized a socio-ecological approach to address the triple threat amongst adolescent girls and young women by providing integrated services to them, both at facility and even at community level. And these services included health education, access to health services including HIV testing, access to HIV prevention methods for those who were identified to be pregnant, access to early antenatal care and skilled birth and deliveries, and really empowering the girls towards social change and towards being able to, as a group themselves, stand up against the triple threat. We have collaborated closely with our national government and even our county governments to really elevate the agenda towards adolescent girls and young women, and really work together to identify champions within our political arena to drive this agenda to really protect our adolescent girls and young women against the triple threat.
Back in Homa Bay, Cintas finds strength in peer mentor, a guiding light who walks alongside her through shared experience and unwavering support. She discovers the power of community in transforming her journey.
Working with these adolescent girls and young women, it's very interesting. Once you create a good rapport, they just come and search you. Where is this person? Where is this person? Because they know you. Through you, they can get good help. Through you, they can proceed. Through you, they can be linked very well in the facility. And I've been creating good rapport with them. And through that, they don't have, even if you contact somebody to come to clinic, through me, they just come. They tell you, today I have exam, I'll come today. We organize. I always reorganize with them. That's why it has been very easy to talk to these adolescent girls and young women, to mentor them. So I also tell them, if you have problem at home, you just come. We'll just do more, so that we don't want the GBV case. A young mother should be living at a safer place, and we have been very, very concerning that and telling them that if you are not at a safe place, just come. If you tell me this time, next time, because if you tell me this time, I have the records. Next time, if it's repeated, now it's too much.
Guided by mentors like Susanna Tieno, Cynthia's story illustrates the transformative power of support and empowerment.
She used to come even pick me from school because she discussed the issue with the teachers, so they were aware. So she used to come and pick me from school so that I can go take the drugs. Until now, I can take them on my own without being told. Anytime if I go to the hospital, I'm being told that come back to this date, I don't fear. I just go back because life has to continue. Despite of everything, maybe that thing you have in your life, life has to continue. Yeah, you have to be strong and continue with your life. Don't look at what was done to you, what you are going through, what you have in your body. Life has to continue. Because the more you continue your life, is the more better things you will achieve. It was not written for you. Something good was written for you to change your life and not to be a disgrace to your life.
Despite it all, Cynthia has remained determined, managing her medications, persevering, and finding strength in her mother's unwavering support.
To the society, let us not look down upon HIV positive people and these early pregnant ladies. Yeah, maybe it's because of how you handle them. It's maybe this nearness between parents and the girl, or it's a matter of peer influence. So don't always just see like this is a wrong person and you see that everyone is giving a negative model. You are being used as an example to others negatively. Let us not do that, but instead let us motivate each other.
Cynthia's journey is a testament to this hope. Her journey from despair to resilience mirrors the journey of countless young women across Kenya.
I want to be a lawyer, a family lawyer. Due to the challenges I do see in family, mine one of them, I just want to be that person to help those who are being abused in the family, maybe to help those women whom their husband are seeing like good for nothing. Yeah, so that's what motivates me. And that's why I want to be that family lawyer, at least to help those who are being abused in the family.
This is a narrative of breaking the silence of young women battling self-stigma and discrimination, not just within themselves, but within the fabric of society. It is a call for understanding, acceptance, and change.
Yes, we have policies, but a lot of work still has to be done to trickle down the guidance to the places where our adolescent girls and young women seek care. A lot more effort is required to really sensitize our health facilities, all our health cadres, including our community health promoters and community health strategy, to really trickle down those policies and guidelines towards equal access to care, towards adolescent-friendly services and person-centered services, so that the impact of the policies and guidelines are felt exactly where the adolescent girls and young women present for care.
As the sun sets over Lake Victoria, we reflect on the journey that has unfolded. From Homa Bay's tranquil waters, we bear witness to stories of strength, unity, and transformation. Chemtai Kiri reporting for Kass TV from Homa Bay County.